So welcome all to Sri Manoraksha training. So today we'll be discussing about psychological impact of violence, assessment of mental distress, mental disorders, and suicide risk. Let's have a look at the learning objectives. The first one is to understand the mental health impact among women facing gender-based violence, to understand the identification and assessment of mental health issues among women facing gender-based violence, to identify the risk factors of suicide and assessment of suicide among women facing violence. So let's have a look at the consequences of violence against women. So it can happen in various spheres, that is related to physical health, sexual health. There can be mental distress, and there can be serious mental disorders as well. So coming to the physical aspect of it, so women can have bruises after violence, abrasions, injury, functional disorders. She can experience pain symptoms. She can also experience fractures. In the sexual health, so it can have unwanted pregnancies. There can be urinary tract infections. There can be unsafe abortions, sexual dysfunctions, and there can be pregnancy-related complications. So coming to mental distress, so mental distress can be, it can affect mildly, that there can be symptoms like restlessness, worry, sleep disturbances, poor self-esteem, anxiety disorders, suicidal thoughts. Coming to mental disorders, there can be anxiety disorder, panic disorder, depression, phobias, worsening of psychosis, PTSD. So we will be discussing in detail about mental distress and mental disorders. So coming, as you see on the slide, coming to this mental health continuum. So what is it? So first, we'll be discussing what is mental health and wellness, and later, which can affect mildly, that is mental distress and mental issues, and a much severe form, which is mental illness. What is mental health? So mental health, as we all know, it is an integral part of health. Indeed, there is no health without mental health. According to World Health Organization, the mental health definition is, it is a state of well-being in which the individual realizes his or her own abilities, can cope with normal stressors of life, and can work productively and fruitfully, and is able to make a contribution to his or her community. So mental health is determined by a range of socioeconomic, biological, and environmental factors. For example, violence and persistent socioeconomic pressures are recognized to mental health. So what is mental well-being? It is the capacity to lead a life with purpose and meaning, where there is a quality of life. So this is about mental health and wellness. So coming to the mental distress and mental issues. So this can be a normal response to stressor. Like most of us experience this, some distress during difficult times, which can affect our daily functioning and routine. But what we have to understand is that it is very transient. It is like a stress response, so which resolves spontaneously with change in situation or with good adequate support, and if there is environmental change, which it can resolve spontaneously, and it is for a very short period of time. So what is mental illness? So how it is differentiated with mental distress? So mental illness is pervasive and persisting in different settings and across time. It can potentially impair functioning in one or more domains of life. There is no certain cause. There can be multiple risk factors. Like we speak about biological model, we speak about environmental model, we speak about social model when we speak about risk factors. So the important highlighting point here is that it impairs the functionality significantly in one's life. So coming to common mental health issues and severe mental health issues. So as we see in both, there it can affect physically, it can affect emotionally, it can affect cognitively, and there can be behavioral symptoms. Here the word cognitive, I want to explain a little bit. It is basically the mental process It's the intellectual activity of a person. It's like example, how you think, how you reason to a certain thing. So these are called the cognitive symptoms, and the other symptoms are quite self-explanatory. That is the physical symptoms, emotional symptoms, and the behavioral symptoms. So coming to the common mental health issues, it definitely affects functioning. If a person is diagnosed to have common mental health issues, it usually requires short-term treatment, and a good amount of support is required when a person is having common mental health issues. So here we mainly speak about certain disorders like anxiety, depression, and medically unexplained symptoms. Coming to the severe mental health issues, as I explained, it can affect physically, emotionally, cognitively, and there can be behavioral symptoms. But what we have to understand in severe mental health disorder is that it affects an individual with a greater impact. So it can impair the functionality of a person. So it can alter, example, the thinking process, like the cognitive, the symptom which I mentioned, it can alter the thinking process. So the reasoning of a particular thing will be significantly impaired. And there can be a lot of physical symptoms and emotional symptoms. This, if a person is diagnosed to have severe mental health issues, he or she requires the immediate attention of mental health professionals, and usually long-term treatment and management is required. We usually refer schizophrenia and bipolar disorder as severe mental health disorders. We'll be dealing about each disorder in great detail in the coming presentation, in the coming few slides. So before we go into each disorder, so let's have a look at the ground rules for assessment. So when a client comes to you, when a woman comes to you, so what are the things which you have to keep in mind before assessing a woman, before speaking to a woman? So first of all, sitting in a quiet place is very much necessary. Ensuring women's privacy and confidentiality is utmost important. Making the client comfortable, because the client, the woman would have already come in great distress. So it's very important, being a counselor, to comfort the client, to keep all the necessary things at ready, like pencil, eraser, pen, like whatever you have to document. So just to keep things ready. And once you document it, it's very important not to give the assessment tools or the pro forma to the clients to take with them, because these are confidential documents which has to be maintained very carefully. So as I mentioned, keep the notes of your assessment out of reach of the client. At the same time, it's very important to build rapport before assessing for mental health concerns. It's very important to understand the client before assessing mental health. Behavioral observations must be noted. Like, for example, if a woman walks in the interview room, so the behavioral observation usually starts when the client steps into your room. So like how she's dressed, how she is coming to your room, whether she's having a good eye contact, whether she's able to like comfort herself, or throughout the interview she's anxious, whether she's speaking comfortably, whether she's not speaking comfortably. So these are the things which you will notice in the behavioral observation. So before starting your assessment, so you will explain about your assessment, like what is your assessment about, why do you want to do this assessment, and how long will this assessment take. It's very, very important to listen to the client, to listen to the woman very actively and very attentively. So she has basically come with a lot of distress, so she wants to be heard. So you have to give that attention to her. It's very important to be very empathetic towards her. Make sure to take consent. So before you start the session, you take consent of the session and tell that everything will be kept confidential. At the same time, it's very important to be non-judgmental, not to give any explicit or implicit signs of your judgment or opinion. It's good to clarify if there is any confusion during your assessment, and not to generalize personal experiences. So next, let's have a look at certain difficult situations while conducting an assessment. I'm sure many people would have faced these difficult situations. For example, when the client refuses to talk for various reasons, when the client is angry, agitated, when she's aggressive, violent, or suspicious, when the client cannot comprehend your questions or instructions, When intoxicated, when the person is under intoxication, example, either it can be alcohol or any other substances, if a client has faced, if a woman has faced immediate traumatic response, and the client is not speaking. For example, if a woman has faced sexual assault, it's one of the common response that client is not willing to speak, is not willing to share. So at the same time, it's good to give her some time, make her some comfortable. So to follow all the ground rules of assessment before we jump into anything else. So next, let's have a look at how steps to do assessment. So first is you'll be covering the socio-demographics. So you'll be asking the name, age, marital status, socio-economic status, domicile, educational qualification, occupation, religion. The main concerns of the client visiting your center. So details of the main concerns, like why they have come to your center, like what are the issues which they are facing, what is exactly happening, and for how long the woman is facing these issues. So in great detail to ask about the main concerns. And coming to other symptoms like mood. So related to mood, so what are the questions you will ask? So these are the basic questions you will ask when you have to assess a person's mood. Like, how is your mood? How do you feel? How are you feeling? So it's always good to have open-ended questions so that you will get more information rather than closed-ended questions. So coming to the behavior observation, as already I mentioned, so you will be assessing like how a person is dressed, if he or she is having any involuntary movements, how is the eye contact towards the counselor, hygiene status, is she able to concentrate, is she able to comprehend or follow the instructions what you are saying. What is the body language like what is the posture, whether that person is relaxed or tense, restless throughout the interview, whether that person is very slow in answering questions, or whether that person is hesitant, or whether they are cooperative during the interview. Coming to the biological functions, so the important biological functions, what we speak is about the sleep and the appetite, like how good is the sleep, whether the sleep is disturbed, and appetite, related to appetite, like how he or she is eating, whether they feel hungry, whether they are able to taste the food as they were doing it earlier, and some questions related to menstrual cycle and bladder bowel movements. Coming to the socio-occupational functioning, like how is their involvement in daily activities, involvement in work if employed, how is the social interaction with family, children, friends, neighbors, whether they are attending any social gatherings like some functions in the family or marriages, etc. So now we covered what is mental distress, what is mental illness. Then we saw some of the ground rules for assessment. We saw steps to do in assessment, and we also covered about the difficult situations during the assessment. So now we'll move on to the next section of our presentation, that are what are symptoms of common mental disorders first. So, and next, what are the symptoms about severe mental disorders? So first we'll have a look at anxiety disorder. So we'll go disorder wise. So first, like in anxiety, what are the symptoms to look for? So first, we'll be speaking about the physical symptoms related to anxiety. So if a person is suffering from anxiety disorder, there can be physical symptoms like there can be excessive sweating, palpitations, that is increased heartbeat. There can be breathing difficulties. There can be fatigue, that is tiredness. There can be sleep-related problems. There can be a lot of muscle tension and pain symptoms. There can be other symptoms like nausea and gastric problems, like they can have heartburns, indigestion. Next, we'll have a look at thought and feeling symptoms. There can be a lot of apprehension. There can be constant worry, example, fear of future, or constant worry that why this is happening to me, etc. There can be difficulty in concentration when they are at work, when they are doing, example, even household chores, they are not able to concentrate at that particular task. So it's like the mind keeps wandering. So they are not able to focus on that particular task. They can have racing thoughts, like they can have multiple thoughts at a time. There can be mental restlessness. So constantly thinking about something, constantly worrying about something. There can be irritability, and there can be symptoms like feeling lost. So coming to the behavioral symptoms of anxiety disorder. So behaviorally, what will you notice when you see a person with anxiety disorder? So the client might not be able to sit still during your interview. They can be constantly fidgeting around, or they can be very restless on the chair itself. There can be a lot of difficulty in focusing on tasks. Like during your interview, if you give a particular task, they might have difficulty in focusing and completing the tasks. And as I mentioned, there can be irritability or social withdrawal. So now let's have a look at some of the questions to assess anxiety disorder. So again, we will divide the questions into thought-related symptoms. That is, so some of the questions related to thought. What you can ask is, do you worry a lot about things? Do you worry a lot about your future? Because that is one of the commonest symptoms in anxiety disorder. Like in future, what will happen to me, whether things will be okay or not. So constantly these kind of thoughts will be running in their mind. Do you find it difficult to focus on work and completing it? So these are some of the questions to assess thought-related symptoms in anxiety disorders. So let's move on to the physical symptoms. So if you have to ask about physical symptoms, you'll be asking like, do you have increased heartbeat and sweating? Do you have frequent headaches? How is your sleep? Do you have at times experienced choking feelings? So as I explained about the breathlessness, so usually the commonest complaint is they feel like choking. They are not able to breathe properly. So do you experience heaviness in chest and associated breathing difficulties? So how do you assess emotions in anxiety disorder? So do you feel fearful without any reason? Do you feel more irritable than usual? Do you feel a sense of inability to relax? So as I was explaining about the mental restlessness, physical restlessness is one part and the mental restlessness is another part. So mental restlessness is basically constantly thinking about something, constantly their mind is running with various different kind of thoughts. Coming to the behavior, so do you feel very restless and experience inability to relax? Do you fidget frequently in between work? So one of the example is constant shaking of legs. So you would have observed many people in the interview, they're constantly moving their hands or constantly shaking their legs. So these are some of the questions to assess anxiety disorder. Now let's have a look at severity of anxiety disorder. So it can be either mild, moderate, or severe. So mild anxiety disorder, where there are minimal symptoms of physical, cognitive, emotional, and behavioral symptoms. It usually doesn't impact the life functioning significantly. Coming to the moderate level of anxiety disorder, symptoms are more frequent and intends to interfere with the functioning. So there can be some amount of impairment in the functioning of day-to-day activities and other spheres of functioning. If a person is having severe anxiety disorder, so the symptoms, what all I mentioned, it is at a greater level, they are persistent, they are recurring, and it significantly impairs the function. So they give a lot of symptoms, what I mentioned. Either it can be physical, either it can be cognitive, emotional, and behavioral symptoms, and where they are not able to function properly in a day-to-day basis. Like example, they are not able to do their work. All the thoughts are interfering their work. So they are not able to, if they are working outside, they are not able to work outside or at home at various levels. So next we'll move on to depression. So what are the symptoms to look for? Again, we have we have spoken at different symptoms. So first we'll be discussing about physical symptoms of depression. That is fatigue, that is extreme tiredness, like in a person who's having depression. So but they would not do any kind of work, but they feel extremely tired. There will be extreme exhaustion. So though they are not doing any kind of work, so they feel exhausted and tired. There can be reduced appetite. There can be increased or reduced sleep. The classical sign of depression is early wakefulness. So, for example, if a person has a routine of getting up by 6 o'clock, so if a person is experiencing depression and if they have sleep-related problems, so they can have early wakefulness, like they can get up at 4 o'clock. So usually 2 hours before their time. So there can be weight loss. There can be other pain symptoms like headache, other bodily pain symptoms, and sensation of increased heart rate. So let's have a look at thought and feeling symptoms. So what you will see when a person comes with depression, so you will be assessing low mood. So they tell that my mood is not okay. I feel very sad. I'm not feeling happy. So these are the certain things which they can tell. At the same time, you can also see there can be irritability. Like for minor issues, they can become extremely irritable. Earlier, they wouldn't have been irritable because of depression. You can see this symptom. There can be negative thoughts about self, future, and others. So it's a very important aspect in depression. So they feel that I'm not worth living. Like, why should I live? So negative thoughts about self and future, that in future, nothing good will happen. That is about negative thoughts about future. And at the same time, like the environment will not change. So negative thing about the environment, about the surroundings. There can be difficulty in concentration. As I explained, they will not be able to focus at their tasks and they can leave the tasks incomplete, or they might actually not take up the tasks itself. There can be symptoms of forgetfulness or indecisiveness, symptoms of low self-esteem, guilt. There can be decreased confidence, thoughts of death or suicide. What are behavioral symptoms? So there can be frequent weeping, frequently crying, decreased interaction with people. So they don't feel like interacting. They want to be all alone. There can be poor self-care. So they don't have any interest in taking bath, brushing, eating, etc. and grooming. There can be lack of interest in all the activities. There can be long hours of inactivity. So as I mentioned, they feel extremely tired, they feel exhausted, so they don't feel like moving. So they can be just lying down. There can be anger outbursts, and there can be symptoms of self-harm. So now how to assess depression? So what are the questions to assess emotions? So the questions are, how is your mood for the past 2 weeks? Do you feel excessively sad? Do you feel like crying often? What are the questions to assess thoughts? So do you feel that there is no hope for the future and it is not worth living? Do you feel helpless at times? Do you feel that it is better to die rather than continuing this life? Have you lost interest in pleasurable activities? So do you feel helpless at times is basically they feel extremely helpless, that their condition, that no one can help their condition in what they are. So the help is not available and they will not come out of this situation. How to assess behavior? So do you think you have lost weight in the past few weeks because of less or no eating? Have you lost interest in activities that interested you earlier? Are you able to do your daily chores properly? Do you feel tired all day? What are the questions to assess physical symptoms? Do you have sleep disturbances very frequently? Do you think you have lost weight in the last few weeks because of less or no eating? Coming to the severity of depression. So if a person is having mild form of depression, there can be mild changes in mood, feeling sad. There can be decreased interest in activities and interaction, or manifestation of any other depressive symptom which are not severe enough to interfere with daily functioning. So here what we have to understand is this mild form of depression can be helped with proper support and some of the counseling techniques. Moderate level of depression, so they can have various symptoms related to depression, but which impacts daily functioning, but are not severe enough to cause impairment. So there is no impairment in the functioning level, but however, it is interfering in the daily functioning. Here, it's important to refer, if a person is experiencing moderate depression, it's important to refer to a mental health profession. What is severe depression? Where there are a lot of symptoms of depression at a greater intensity, which is persistent and which is severe enough to cause impairment in daily functioning. And here it's very important to refer to a mental health profession if you notice severe depression. Here, one important note is that to important assess suicide for when you see a person with depression, it's very important to ask questions related to suicide. So we will be covering about the suicide risk assessment and interventions in our next presentation in great detail. Next, we'll move on to summitization disorder. This is a disorder which is characterized by preoccupation with a physical or bodily symptoms like pain, which is the commonest symptom that cannot be medically explained. These symptoms cause significant emotional distress. The preoccupation causes significant anxiety and impacts the daily functioning and quality of life. These symptoms are multiple and recurrent in nature. Most of the times, the physical symptoms are manifestation of inner psychological problems that are not addressed or resolved. Here a person comes with a lot of pain symptoms, like they can have pain in the shoulder, hands, legs, headaches, etc. But however, it's very important that these pain symptoms are not medically explained. So they're constantly preoccupied with these pain symptoms, which is actually causing them a lot of emotional distress. So usually what happens is when a person is not able to kind of probably verbally speak about their emotional distress, so it can actually manifest in symptoms of pain, in bodily related symptoms. So like how we speak about the mind-body connection. So when a person is not able to express their feelings, which can actually take up in the form of the physical symptoms. So what are the symptoms? Pain is the most common symptom reported. As I told, it can be areas of pain in the forehead, chest, arms, legs, joints, back, abdomen, and other areas. So some of the neurological symptoms can be like frequent headaches, weakness, dizziness, fainting. Digestive symptoms like abdominal pain or bowel problems, diarrhea, constipation. Sexual symptoms such as pain during sexual activity or severe pain during periods. So usually a person with summitization disorder, there is a constant worry about that there's a potential illness, there's a severe illness which has happened to them. There's a feeling that medical evaluation and treatment have not been adequate. So they can tell that no one is able to understand my pain symptoms. And usually doctors tell like all the investigations are normal, the scans are normal, the blood tests are normal. So they feel that they are not getting proper attention, or they are not diagnosing it properly. So there is frequent and repeated checking body for abnormalities. So they can go to multiple doctors, and they can reach out multiple people for their pain symptoms. How to assess for summitization? So do you frequently have aches and pains all over your body? Do you frequently have aches and pains on specific parts of your body? Have you visited many doctors to treat aches and pains? Do you take a lot of medications or self-medicate to get rid of aches and pains? Do you also feel sad or stressed out when you have aches and pains? Has your sleep and appetite been affected significantly? Do these physical complaints affect your daily routine and your social life? Do these physical complaints restrict your mobility? Now let's have a look at post-traumatic stress disorder. So what we call it as PTSD. What is PTSD? It is a lasting consequence of traumatic events that cause intense fear, helplessness, or horror. What is complex PTSD? That is, it is experienced by people who have repeatedly experienced traumatic events such as violence, neglect, or abuse. In PTSD, the experience of traumatic event may not be experienced repeatedly, which kind of differentiates from complex PTSD. So what are the symptoms of PTSD? So they usually have night terrors. So we'll be dealing with each symptom in detail. They can have nightmares, fearfulness, flashbacks, disturbed sleep, avoidance of situation and triggers related to violence, negative beliefs about oneself. There can be symptoms of hypervigilance. So what is flashback? It is distressing memory of the trauma. It can be unwanted and intrusive in nature. So reliving the trauma as if it was happening now. It usually takes over all the senses. For example, if a person who has faced trauma, who have like a physical violence, so they constantly feel, if they have a flashback symptom, so they constantly feel that they are kind of, they feel that they have the sensation that they are being hit. So reliving the trauma. What is hypervigilance? It is a state of heightened alertness accompanied by behavior that aims to prevent danger. So you're extremely alert about the surroundings, like what is happening around me. You're extremely sensitive to the environmental cues. In this, there can be physical symptoms like breathing very quickly, being restless. There can be increased heart rate. Behavioral symptoms like jumpy reflexes. Emotional symptoms like fear. There can be panic symptoms, and they can vary a lot. What are night terrors? It's also known as sleep terrors. During a night terror, a person appears to awaken and scream or shout in terror. The content is not remembered. They cause increased heart rate, flushed skin, sweating, kicking, and thrashing in the bed. What is a nightmare? These are usually unpleasant dreams that are usually remembered upon waking. So this is one of the differentiating point between night terror. So they have unpleasant dreams and they get up and they usually remember like what was the dream. It starts after a traumatic event. It follows the experience of trauma and often involves the same elements that were in the trauma. There can be signs of sweating, increased heart rate, and they can be extremely fearful. How to assess PTSD? So what are the questions you will be asking? Do you get scary dreams which bother you a lot? Do you have flashbacks of past painful events? Does anything remind you of your past painful events, such as any program on the TV or newspaper? Do you avoid them? Do you become vigilant or alert on listening to some sudden sounds or something which makes you fearful? So do you feel fearful sometimes? Do you have disturbed sleep? Do memories of your past painful event keep intruding in your thoughts, which you are not able to control? Do you try avoid thinking of past painful experiences? So now we had a detailed discussion about common mental disorders that we covered anxiety disorders, we covered depression, we covered summitization disorder, dissociation, and PTSD. So now next we'll move on to severe mental disorders. So severe mental disorder is defined as mental, behavioral, emotional disorder resulting in serious functional impairment, which substantially interferes with or limits one or more major life activities. So that's one of the differentiating point between common mental disorders. So in severe mental disorders, you can see it affects the life significantly. They're not able to function, they're not able to think, they are not able to reason properly. So let's move on to symptom-wise. So what are the behavioral symptoms? There can be aggressive behavior. So without any provocation, they can start being physically aggressive, hitting things, throwing things without any provocation in the environment. You can see disorganized behavior like eating dirt, mud, not maintaining adequate hygiene. They can be extremely dirty. You can see symptoms like talking to self, like just sitting in one corner and just gazing and talking to oneself. So like even if you interrupt them and if you try to speak to them, maybe they will not give appropriate responses. There can be poor self hygiene, as I mentioned. There can be loss of social skills, like they would not know how to interact socially, so they would have lost the reasoning, or the thinking capacity would have come down. And other symptoms like isolation, that is withdrawing from the friends and other social activities. What are the emotional symptoms? There can be extreme mood changes of highs and lows. So suddenly in a day, you can find like they are irritable. At the same time, after some time, their mind can be stable. So there can be extreme mood changes, difficulty in understanding and handling emotional experiences. There might be difficulty understanding in the other person's what emotions they are undergoing and about oneself. They can be laughing and smiling inappropriately without any reason, and making big and unrealistic plans. For example, in bipolar disorders, so they feel that they have a lot of energy, they can make big plans, they can buy a lot of things, they have a lot of money, though these things are not true. What are the thought-related symptoms? They can have false beliefs, which is commonest symptom in psychosis or schizophrenia. Example, like people are plotting against me. I'm a God's messenger and I have powers to save the world, which is actually not true. The inability to think rationally, lack of logic, that is one important symptom. Suspicious, they're extremely suspicious. So having fixed, rigid beliefs about things that are not true. Again, for example, they feel in psychosis or schizophrenia, they feel that the food is being poisoned. So they stop eating, they avoid eating. So, which is actually not true. So they're extremely suspicious. And some other symptom, like people tell that they have done some black magic. So they avoid a lot of things. There can be disorganized thinking leading to disorganized speech. There can be inability to concentrate. And another symptom is hearing voices. So it is a commonest thing which you would have noticed or you would have heard about it. Like they say that I hear voices, either one or multiple voices, which are coming from outside or whatever, but which are actually not there. The voices are not there, but they hear. So this is another commonest symptom in severe mental disorder, especially psychosis and schizophrenia. Now, coming to the last part of our presentation, let's move on to the referral process. So if you come across a person having either common mental disorders or severe mental disorders, and if you think based on the interview or based on the questions like which we have given for each disorder, so based on your interview and based on your assessment, you feel that particular person has to be referred to a mental health profession. So let's see when to refer to a mental health profession, whom to refer, and how to refer. So when to refer? So if there is a risk of self-harm or suicide, definitely you have to refer immediately. If the survivor is so depressed that she cannot do any day-to-day activities, as I mentioned, severe form of depression and even moderate form of depression. If a person is having PTSD, and if they have flashbacks, nightmares, anxiety, or other symptoms of PTSD, and if you have started your counseling, if, for example, mild form of depression, if you have started counseling, but however, the person for various reasons is not improving, so still there is psychological distress which persists, then probably you have to refer to a mental health profession. If there is psychosis or severe mental illness, definitely you have to refer to a mental health professional. If there are difficulties in individual, social, and at occupational level, you will be referring to mental health professional. So whom to refer? So either you can refer to a psychiatrist, a clinical psychologist, psychiatric social worker, counselors, district mental health program doctors, the primary care doctor. So how to refer? So this is a process which is an important process, how to refer. So first, after your assessment, after your interview with a client, so if you feel that this a particular person has to be referred, so you will set up an appointment with the mental health professionals as described. Then call the mental health professional and brief them about the case. Like during an interview, what were the salient points which you noted? And for example, if you come across suicidal thoughts during an interview, so you will be mentioning the salient points to the mental health professional. Make a referral letter, which is an important aspect. So you will be mentioning about the the client's important details, like what were the salient symptoms and the demographics and why you are referring. So make a short letter, and you'll be giving the same letter to the client. And also at the same time, it's very important to tell the client that why you are referring and why you feel that there is a referral and why there is it's for their betterment and to understand them better and for better interventions. And it's always good to have a follow-up after the referral, like what they felt, what the mental health professional felt, and what diagnosis they made, what is the line of interventions which they are following. And also, as I told, give a feedback to the survivor. Thank you for patient listening. Any questions?